We're continuing the review of specific requirements for hospice admission. When you are admitted to hospice with the diagnosis of liver disease, these first two criteria must be present. The INR, which is the measure of the bleeding time, is greater than 1.5. The serum albumin is less than 2.5 grams. There will be progressive malnutrition despite adequate intake with an appearance of cachexia. That sunken temporal membranes, bony prominences are shown. The skin is very dry and fragile. You will see muscle wasting along with decreased strength and endurance. There is need for assistance to stand. The patient can only ambulate a few steps. There's shuffling gait. They really require assistance in all ADLs. And one of the following should also be present. There might be refractory ascites, which may compromise their breathing, bacterial peritonitis, recurrent varicose bleeding, hepatic encephalopathy, hepatorenal syndrome with an elevated creatinine. They might also have an elevated BUN. Oliguria with less than 400 milliliters of urine in 24 hours, and the urine sodium may be less than 10 milliequivalents. Be aware that the patient with liver disease may continue with alcohol consumption. Find out their current habits, if you can, of consumption and educate them on its continued use, which of course will cause a speeding up of their disease and symptoms. You might consider a contract with the patient such as, I promise to only consume 1 pint of vodka a day. The patient, of course, may refuse, and likely, if alcohol led to their having liver disease, it will continue. Remember, for recertification, to always document any changes in their lifestyle. Emphasize that ongoing care is the priority. In our next video, we're going to move on to pulmonary disease. But remember our YouTube channel, the Hospice Care Plan, where we teach you to manage all of the major symptoms. And no matter what the disease is, our booklet will give you a crash course in hospice care and how to take care of that patient. It's at thehospicecareplan.com. And remember our motto, care is treatment.